The COVID-19 pandemic, maybe you pardon me, probably I had to remove it because I would be otherwise, gasping a little bit. The COVID-19 pandemic has caught us all unawares, causing unprecedented challenge to public health, food systems, and the world of work, especially to pharma and life sciences industries. This pandemic has made a big dent. While both these industries, that is pharmaceuticals and life sciences, had been expected to deliver more during the pandemic in order to contain the emergency, but during this process of last 9 months, it has caused a severe stress. Millions of enterprises worldwide are facing an existential crisis and the threat of even closure. The life-saving drug manufacturers in these circumstances were stressed due to the lockdown, which has long for almost like 4 months. On one side, there was a pressure to ramp up manufacturing, but at the same time, the broken supply chain, restrictions on movement of people, vehicles, and everything has aggravated the situation to provide consistently high-quality medications to India and to the world. In the circumstances when the physical distancing and several pandemic measures to be followed, the industry found itself into a situation which we have never faced. During the last 2 days, both in the healthcare conference and also the conference of the educational institutions, IT industry, hospitality, etc., we have repeated several times that the current pandemic is something like which happens once in a century, which is true to some extent. But it is not true from the perspective that the epidemics and pandemics, they are happening with the increased rapidity and also the increased calamity which it can cause to the public. But despite of this, while complying with ever-changing regulations during 9 months from the lockdown period, industry has done a commendable job. Definitely we need to applaud for all those industries, despite of this stress, have maintained a good level of manufacturing without foregoing the quality standards which are required. For that, I would like to give a round of applause for all the pharma and biotech industries. Although the COVID-19 pandemic continues to transform the growth of various industries, the immediate impact of the outbreak is varied. While a few industries will register a sharp decline or a drop in the demand, the other industries, which are numerous in number, will continue to remain unscathed and show promising growth opportunities. And luckily, the Indian industries have shown that resilience and came out of course, although we cannot declare that as we haven't yet declared the end of the pandemic, but looking at the current situation, we can safely say that most of our industries luckily have come out of the pandemic unscathed. Clean room technology industry is also gearing up in line with the demand due to the pandemic. The clean room industry, including decontamination product manufacturers, have come with several innovations to help pharma and life sciences industries to cope with the pandemic and enable them to kind of smoothly transit into the new normal which we had been talking about. Today, in the exhibition hall, you have seen several companies who have come with the products which we have never heard of before. So it shows actually the ability of Indian industry to very quickly come with innovative ideas, ramp up that production, and also give the solace to the public and also to the nations to come out of any emergency. Of course, there are many ins and outs to navigate when it comes to maintaining a proper clean room. It's also an unfortunate truth that decontamination is not that all easy. Experts who are here in this hall and also who are witnessing, probably they would agree with me. The US FDA and other regulators like UK MHRA, TGA, etc., those warning letters which they have issuing with increasing frequency to our Indian industry, that proves that there is a room for improvement and there is a need for improvement in order to remain a global leader. That is what is the position which we already have occupied. I think our industry should be marching, scaling the new heights in the years to come. I am sure during this day, you will be able to get everything you need to know about the most common sources of clean room contamination. Plus, you will learn how to prevent them as much as possible. While I have said about the warning letters and also the room for practices, the good news is that today you have come to the right place, attending this conference, listening to the experts. I am sure you will benefit with their tremendous knowledge and also the experience. Some of them have the experience of 4 decades or 5 decades, taking care of the quality affairs. Let me attempt to outline the major issues so that we can set the tone for several expert presentations which are planned for the day. One of the major clean room issues is the human hygiene. Although I am on the both sides of the thing, being a clinician, at the same time an entrepreneur who has started a company, I am aware of the fact that the human hygiene, especially in the tropical conditions and the developing world conditions, is a big challenge which had to be taken care of. So it remains actually a prime reason for one of the contaminations within the clean room industry. This is a particular threat to clean rooms. Believe it or not, the biggest threat to the purity of a clean room is the presence of humans themselves. This is true in particular when an employee does not practice appropriate hygiene. In fact, even experts recognize that the presence of microbiomes from humans in clean rooms have a detrimental effect. For this reason, it can be of particular importance to train and educate our clean room employees of required hygiene habits. I am sure one of the presentations today is also going to deal with that. Second major issue is about the non-compliant equipment and supplies. I would not dwell into the details because the experts are going to talk about. I rather would move on to the third one, which is basically the kind of environment which surrounds our facilities, which also has got a major impact on our clean room practices. And the last but not the least is the facility itself and the airflow. Today, again in the exhibition, we have got some of the companies who are dealing specifically with the air contamination within the clean rooms. I am sure while discussing with them, you will be able to find the solutions. As I told you that, let me not dwell into the detail. I will stop here in terms of giving the outline for the discussions which are to happen. I request you to make most out of this particular conference of today, so that you can have a thorough understanding of how to deal with the decontamination without cutting the corners. That is very, very important. When it is about contamination, I think enough had to be invested in order to maintain the end product quality. Without that, we will not be able to ensure the patient safety ultimately. Because as an industry, our primary goal is to save the lives. If we are not going to take enough precautions in order to maintain the quality, then the whole effort which is put in by several stakeholders comes under risk. Today, the conference was supposed to be attended by several other dignitaries from Drug Control Authority, Pharmaceutical Export Council, BDMA. Because Dr. Preeti has the election duty, she could not attend, but through me, she has requested to convey to all the delegates and the participants of the conference her warm regards and also her words of support for the kind of activity which is going to happen today. The same with Dr. Uday Bhaskar, the Director General, Pharmaceutical Export Council. He has wished us all the best, and he has promised actually to give a special focus and probably create a special focus group in order to further take up this issue of decontamination in both pharmaceutical industry and also the life sciences.